And welcome back. Thousands of South Africans have made the call for booster shots to be administered now as a strain of COVID-19 has been discovered. We do need them immediately, they say. Would they be able to assist in the rising COVID numbers is a question. In terms of the festive season rollout, COVID vaccine boosters will only be available to the public in mid-December, it may be. To speak a little bit more about this, we speak to Professor Mosa Moshabela, who is at the University of KwaZulu-Natal. He's the vice-chancellor, research and innovation for vaccine, or rather for virology. A very good evening to you, and thank you so much for speaking to us, Professor Moshabela. So let's first start with booster shots. I mean, we know that the West has been doing that, particularly America. I mean, it's one of the things that they're still struggling with. They're still experiencing COVID-19 infections, even though they've already started rolling out booster shots. What is the purpose of booster shots, and is there hope for South Africans?
Yeah, greetings, SABC, and to the viewers. I think that, we are not at the same stage of vaccination in South Africa as we see in the US or other countries in Europe and some other countries in Asia. And for that reason, I think that booster shots have been something that to entertain because of the extent of vaccination rollout that they have achieved, which is about 60-70%. And at that point, they also have a large amount of vaccine supply. And so they have been actually reducing the age limit that they were using when you go under, including children who are between 5 and 11. So in that context, Tsepiso, it's easy to then consider what else to do with the vaccine supply that they have in order to gain more benefits. So boosters will give an added benefit given the evidence that antibodies wane. But the evidence around it does not necessarily support boosters for everyone, only in certain situations.
So what would that be? And talk us through that, especially as we know that the Sisonke trial ends, I think, the 15th of December. So what would then be the consideration and process of elimination, and whom ought to receive booster shots?
Yeah, I think in general, the consensus in the scientific community is that people who are most at risk can benefit. So people who are 60 and above, and if someone decides that they will use a cutoff of 50 years, that's okay. But in general, people who are 60, 65 years and above, we know they're at increased risk. So there is a case to be made for those people. People who have immunocompromised for whatever reason, be it cancer or cancer therapy or some other condition that limit their immune system to respond optimally, they can benefit from an additional dose. And in those cases, we don't even call it a booster. It's just an additional dose to help bump up their response. But we've also made provision for healthcare workers who we know are consistently in the front line of COVID whenever we have a surge of infections or a wave. So because of that increased exposure and risk, we understand that they may need a booster, especially in South Africa, given the fact that they were the first ones to receive the vaccine. So their immunity antibodies may be waning. So those categories are the ones that there is consensus. Some people with comorbidities may be considered, but it is certainly not a situation to be considered for everyone.
Now, just looking at health professionals, so they, I believe, could be receiving those booster shots as time goes on, as you say, particularly if we're going to face a new variant, therefore greater transmissibility. But would that be at the risk of not vaccinating other people who have not been vaccinated? We know some people have been a little bit hesitant. Should they come forward now and say, given the risk that we're facing, we would like to get vaccine shots? Would there be some sort of, decision that had to be made to say public health officials first, or those who have not been vaccinated?
I think that question for me is the crux of the issue. It's the heart of the issue. If in South Africa, we can quickly make a decision about how we are going to balance providing vaccines to those who have not received the first dose, and also providing boosters to those who need it. Because in a way, the priority should be boosters for the people who are most at risk and likely to end up in hospital. But also, it's a priority to give a vaccine to a person who has not received it. So for health workers in South Africa specifically, under Sisonke, we know that those doses were donated by Johnson & Johnson. They are not necessarily coming out of our supply. However, if South Africa approves Pfizer, for example, for a booster, then we'll have a situation where it may come out of the supply. So all of those decisions, that question that you're raising becomes the dilemma that requires careful thought and careful balancing so that you don't lose on the one hand while you're trying to plug a leak on the other hand. So really, for me, that's the main issue. And the balancing there is going to be necessary.
So as you talk about people who are immune compromised or who are vulnerable to a severe infection of COVID-19, are they then able to get a prescription from their doctor for a booster shot? And where would that booster shot come from?
Yeah, so I think the submission by Pfizer to SAPRA for booster is just for all adults above 18. And so it would then allow the Department of Health to release a policy that will guide that process. And my understanding is that the Department of Health has been working on a policy to essentially guide who can get a prescription for a booster shot or an additional dose. As I said, for those who essentially are not able to mount enough immune response, they will be getting an additional dose to top up rather than a booster. So in as much as that distinction is not a major one, it's pedantic, but it is important just to clarify so that when that prescription comes, people don't then think that it is sort of a luxury to get a third dose for people who are immunocompromised. It will be a basic necessity, and it will come out of the main stock. In those cases, we expect the prescriptions to be linked to what we call service delivery rather than research studies.
All right, thank you so much for your time and your insights. As always, Professor Mosa Moshabela, who's Professor of Public Health and Deputy Vice-Chancellor Research Innovation at the University of KwaZulu-Natal for Vaccinology.